Have you ever wondered what actually happens when a player goes down clutching their leg and the whole stadium gasps? Is it real pain, or just another Oscar-worthy dive? From ankle sprains that ruin title races to ACL tears that sideline stars for months, football injuries are the great equalizer. They spare no one, not even the best. Football is wonderful, exhilarating, and frankly, a little bit dangerous. Every time a player steps onto the pitch, they're not just battling their opponents, they're taking on physics, fatigue, and sometimes their own bodies. Injuries can disrupt careers, wreck team momentum, and cost clubs millions. So today, we're diving deep into the world of football injuries, what they are, how they happen, and why understanding them might just change the way you watch the game forever. In football, injuries come in two broad categories: acute and chronic. Acute injuries are those sudden, dramatic events, the boom, that's not good kind of injury that happens in a split second. Think sprains, fractures, or nasty collisions that stop play instantly. Chronic injuries, on the other hand, are slow burners. They develop over time through repetition, poor recovery, or constant pressure on the same muscle or joint. They're the aches, strains, and overuse problems that sneak up quietly, like a small leak in your roof that turns into a flood when it's too late. The difference between the two isn't just medical, it's strategic. Teams manage acute injuries with immediate care, but chronic ones require long-term planning, player rotation, and smart training routines. Understanding the difference matters because prevention, treatment, and recovery timelines vary significantly, and handling them the wrong way can turn a few days off into a season-ending nightmare. Let's dive into acute injuries, the ones that make you wince, grab the remote, and wonder whether the game might end early. Sprains happen when ligaments, the tough bands that connect bone to bone, are stretched beyond their limit or torn. In football, ankle sprains are ridiculously common. You change direction, a foot gets planted, the weight shifts, boom. Risk factors include poor balance, fatigue, uneven surfaces, and inadequate warm-up. Symptoms: pain, swelling, instability, often a popping sound at the moment of injury. Diagnosis is clinical plus sometimes imaging. Treatment involves rest, ice, compression, elevation, the classic RICE, then rehab to restore strength, and proprioception. Recovery time might be 2 to 6 weeks for a mild sprain. More severe tears may require months. According to systematic reviews, lower extremity injuries account for a massive chunk of football injuries, over 80% in male professional players in some studies. Sprains matter because they often trigger further problems if ignored. Strains involve muscles or tendons, and hamstring strains are the gift that keeps on costing for many clubs. Why? Sprinting, changing direction, fatigue, and previous injuries all raise risk. In one Premier League-era review, hamstring injuries accounted for about 24% of muscle or tendon injuries, and recovery often exceeds 30 days. Symptoms include sudden sharp pain at the back of the thigh, swelling, bruising, and difficulty sprinting. Diagnosed with clinical exam, sometimes MRI. Treatment involves active rehab, focusing on eccentric strengthening, flexibility, gradual return to sprinting. Mild grade 1 strains might be out for 2 to 3 weeks. Severe tearing may sideline a player for 3 to 4 months. For top-level footballers, the pressure to return quickly can increase re-injury risk. Fractures are straightforward but serious. In football, clavicle, collarbone fractures, metatarsal breaks, or ankle fractures can knock players out for extended periods. Causes: heavy impact, falls, collisions, or forced twisting of a bone. Risk factors: contact games, overuse of lighter protective gear, previous injury. Symptoms: immediate pain, visible deformity, inability to bear weight or use the limb normally. Diagnosis via X-ray or CT scan. Treatment varies: casting, surgical fixation, sometimes plates and screws, followed by rehab. Recovery: a simple upper limb fracture might be 6 to 8 weeks. A complex lower limb break in a sprint-based sport could be 4 to 6 months or more. When fractures occur during high-stakes matches, they can shift momentum dramatically. Contusions are the less glamorous but still painful injuries that happen when a muscle gets smashed. Now, to the scary one: concussions. In football, head injuries aren't as common as leg injuries, but still significant. Estimates suggest between 4% and 22% of football injuries may involve the head. Causes: aerial duels, head-to-head collisions, falls to the ground, even ball-to-head contact. Risk factors: previous concussion, inadequate neck strength, higher intensity of play. Symptoms: headache, confusion, dizziness, nausea, balance problems, sometimes memory loss. Diagnosis is clinical, with protocols like SCAT5, Sport Concussion Assessment Tool. Treatment: immediate removal from play, graduated return to play protocols, resolution of symptoms before resumption. Recovery: most players return in 7 to 14 days for mild cases, but more severe cases may take weeks or months. Repeated concussions can cause long-term issues like CTE, chronic traumatic encephalopathy. Clubs now invest heavily in concussion protocols because failure to act can lead to long-term harm. Stress fractures are tiny cracks in bones caused by repetitive loading, especially in fatigued muscles that fail to absorb impact. In football, stress fractures often affect the metatarsals, tibia, or pelvis, thanks to repeated sprints, jumps, and direction changes. Risk factors: high training loads, calcium/vitamin D deficiency, poor biomechanics, inadequate recovery. Symptoms: gradual onset pain, especially with weight bearing, sometimes swelling. Diagnosis: clinical exam plus MRI or bone scan. Treatment involves rest, sometimes bracing or reduced weight bearing, then gradual return. Physiotherapy, shockwave therapy, and long-term load management. Recovery: typically 6 to 12 weeks minimum, sometimes months if severity increases. Recent research emphasizes managing sprint loads and jump frequency to reduce incidence. Preventing injuries isn't about luck, it's about planning, discipline, and smart work. Research indicates that cumulative exposure and fixture congestion increase stress, fracture risk. One recent report notes injuries cost top European leagues nearly $800 million in 2023 to 2024, with over 4,000 injuries recorded. For footballers, key strategies include structured warm-ups, e.g. FIFA 11+, progressive training loads, adequate rest and recovery, strength and conditioning programs targeting high-risk muscles, hamstrings, calves, adductors, and use of appropriate protective gear, shin pads, ankle braces, proper boots. Match scheduling and recovery time are also vital. Teams that monitor individual fatigue, adjust training intensity, and rotate players smartly reduce injury risk. For example, systematically preparing for change of direction loads, using neuromuscular training, and ensuring players hit benchmarks before returning reduces re-injury rates significantly. Understanding football injuries is essential for players, teams, and even fans. We've covered both acute and chronic injuries, looked at causes, treatments, and recovery times, and offered prevention strategies to keep bodies intact and careers alive. With so much at stake: trophies, contracts, health, it's up to everyone involved in the sport to take injuries seriously. Stay informed, stay safe, and appreciate the effort behind every return. Because the beautiful game is far more than just a goal. Sometimes it's about resilience, recovery, and the journey back. And that wraps up our deep dive into every football injury explained in 10 minutes. From ankle sprains to ACL tears, we've covered it all. Every bruise, crack, and strain that makes football both thrilling and terrifying. If you learned something new or just winced in sympathy along the way, make sure to hit that like button. Subscribe for more football breakdowns, stories, and behind-the-scenes insights that keep you one step ahead of the game. And hey, drop a comment below. What's the worst football injury you've ever seen? Or maybe even had yourself? Just don't make it too graphic. We've had enough pain for one video.